Thanks for joining us again on the Senior Report. I'm your host, George Cruz. Today we're on location at Delaire Nursing and Rehabilitation Center in Linden, New Jersey. We strive to bring our viewers information, services, and products our seniors and their caregivers may need. So we chose Delaire Nursing and Rehabilitation Center to keep you informed of a service that you may need to keep you as home as long as possible or to provide you with care for the rest of your life. We have Kevin Fisher, our Director of Nursing at Delaire Nursing and Rehabilitation Center. Welcome to the Senior Report, Kevin.
Thank you for having me.
Sure. Our viewers at home would like to know how to choose a nursing home and what to look for when we visit a nursing home for a tour.
That's a very good question. When people come in to tour our facility, I usually let them know there are certain things that you must do. Keep your eyes and your ears, as well as all your senses, in tune, because there are certain things that you don't see or hear during the tour, but if you look around, you would be able to notice them. One thing, we look at the cleanliness of the place. When you go to touch things, you don't have dust or grease on your hands when you're going by. You make sure that your sense, as far as your sense of smell, you don't have urine in the air or any type of odor that might offend you. These are two big senses that you have to look at. As far as your eyes, see how well the staff reacts to you and to the residents while you're doing that tour. You also notice the response as far as smiles and whether or not it's a happy place.
Kevin, what levels of care does Delaire provide?
We provide many levels of care. They go from very acute care, which is people that are post-op, maybe 1 or 2 days, all the way to long-term care, where they need the assistance every day. We also take care of people that are cognitively, that have cognitive deficits.
So I read in your brochure you have an assisted living community, a long-term care unit, a dementia unit, and a subacute unit.
Yes, we're very proud of that because that gives you all levels of care. For those people that are independent enough to be able to just have someone there for security, to the person that needs total 24-hour care, which is in our long-term care.
So Kevin, what do you do as Director of Nursing? What is your role?
My role is to make sure it's two-handed. It's one, making sure that we have the right staff, the talent, the customer service that I need for our residents, and overall making sure that whoever comes through those doors gets the care they deserve.
It's a big facility. Do you know your residents?
I make a point of making sure that I know all my residents. I meet with my residents. We have a care plan meeting, which is within 5 days. I look over every pre-admission to make sure that I know a little bit about every one of my residents. I believe that if you don't know them by name, you're not doing your job.
How would you describe your nursing staff and the type of care they provide?
Talented, committed, devoted to their jobs. They are not only skill-wise, but personality-wise. They care about their residents.
What type of staff do you have?
Oh, we have a variety. I call it the Little United Nations.
I mean, as far as positions, registered nurses, LPNs.
Oh, okay. We do have registered nurses. We have LPNs, which are licensed practical nurses, and we have certified CNAs.
And does your staff reflect the community? We have a varied community.
And that's what I was saying
And I think
before,
that's
and I was trying to, that whether you speak Spanish, Russian, Polish, Creole, we have English, we have someone that is here 24 hours a day that can relate to whatever language you speak.
So you have assisted living, long-term care, dementia care, subacute rehabilitation, and I also read in your brochure that you have a Latino cultural program.
Yes, we're very proud of that. We rolled that out about 6 months ago, and with success. We also have a medical director by the name of Dr. Munoz, who's in charge of the Latino community that we have. Like I said, we service the community, and the community consists of this gigantic, wonderful melting pot that we have. So,
Thank you. If a patient in a hospital needs rehabilitation services after a hospital stay, how do they access your service?
well, they can either check online, they can come in for tours, they can ask the social worker at the hospital or case manager that they have about our facility, because all of our hospitals in the community know about Delaire.
Thank you, Kevin. I've heard so much about the rehabilitation department at Delaire. Can we see that part of Delaire?
Absolutely. It's a very active rehab department. It's 7 days a week, and we've got nothing but praise from every one of our residents and patients that have partaken in rehab in this building.
Thanks, Kevin. That's our next stop at the rehabilitation unit at Delaire. With me today is Mahima Dumak, the Director of Rehabilitation Department at Delaire Nursing and Rehabilitation. Welcome to the Senior Report, Mahima.
Thank you, George.
The size of the gym is quite impressive. Can you tell me what services you provide the residents at the Rehabilitation Center?
We do have physical, occupational, and speech therapy services over here.
Okay. What type of equipment does the rehab department use to treat the residents at Delaire?
We do have some modern equipments, and we do have a lot of equipments. The best over here we have is an Omni VR. This is used for balance training, gait training, wheelchair training, and many other things. I basically like to use it for balance training in our elderly population. It's interactive, so they enjoy doing it. They are not bored of doing these exercises, and they can keep on working on it. This is interactive. The camera over there detects the patient, and it corrects the patient. It will not give the patient scores if the patient is not doing some activity as they are supposed to do. So it also corrects them.
So does it print out a report for you?
It does.
on
It
how they're
does
doing?
give me a report of every session on how the patient is progressing.
So with this, I know you have other equipment throughout the gym. Can you give me just a brief overview of what you have here?
We have a high-low mat, so patients of different heights could use it. We have an Omni cycle. This cycle, I love this one because even if the patients cannot get out of the wheelchair, we can just attach the wheelchair over here. We can secure the wheelchair with the straps, and patients who are max assist dependent in anything, they can still do it. If the patient cannot do it by themselves, this machine does help them do it passively.
I see. So a motor helps their arms or legs move?
Yes.
Okay, and I notice you have the arm, the hand bikes, is it?
Yes.
what
People
is
who
that?
can do without passive, who can just do it for strengthening or cardiac strengthening, they can just use the arm bikes.
Okay. And you have steps, you have, what do they call this again?
We have parallel bars over here.
Parallel bars.
Patients who cannot walk with rolling walker or cane, who need more assistance initially to stand, we start training them in this.
Okay. And you have steps for when a resident needs some
For
therapy, going up
patients
and down
who
the
will
steps.
be going home, we do need to practice steps because they do have steps, if not at home, at least for doctor's visits or when they go to the mall. So we do have practice stair training over here.
Very good. And you have a small weight
We
gym here?
have, yes. We do get a lot of younger adults nowadays. They do enjoy this. It's like having a gym over here.
So subacute rehab and rehabilitation isn't only for the elderly, a younger person may be
Yes.
injured in sports,
Yes.
or someone who
definitely.
has knee or hip problems that are in their, let's say, 30s and 40s or
Yeah,
50s.
we do get sports injuries patients who are young, who do need total knee replacement, and they enjoy all the activities and equipments over here.
So what type of staff do you have?
I do have physical therapists, physical therapy assistants, occupational therapist, and speech pathologist.
What are the typical diagnoses that you see coming into Delaire subacute rehab?
We have total hip replacement patients, total knee replacements. We have some neurological conditions like stroke, multiple sclerosis, Parkinson's. We do get open heart surgeries, stent replacements, and many other like fractures.
So the residents that come in for subacute rehabilitation center, of the service, do most of them go home?
Yes, I would say a lot of them do go home. Younger adults definitely go home. Very few of them do land up staying with us in the long-term cares, but we also provide therapy for the long-term care.
Thank you so much, Mahima, for joining us on the Senior Report.
Thank you, George.
At the end of your subacute rehab stay, the social worker will refer you to a home health agency, visiting nurse agency, or outpatient rehab. Today we have with us Jane Bradzionis from Beyond Caring Home Care Services. Welcome to the Senior Report, Jane.
Hello, how are you?
Very good, thank you. Jane, after a stay at a subacute like Delaire, residents usually are usually referred to some type of service. What type of services does Beyond Caring provide?
We provide home care services to the community, different levels. They're either short-term, long-term services, and they can range from anywhere to geriatrics to pediatrics.
Can you come in to see them in the subacute rehab unit before they're discharged?
We can, if the RN needs to make an assessment, we can do that. And our company will definitely come out, someone from the company that they speak to will come out to meet them as well.
Okay, and do you provide different caregivers with different language?
Yes, we have several languages. We have Italian, English, Haitian, which is Creole, Russian, and that is in English, of course.
Of course, so you run the gamut of all the languages.
We try.
What should our seniors look for, or our seniors caregivers look for when they're looking for a home health agency? What questions should they ask?
They should ask if they're licensed, are they home health aid certified, are the RNs registered, bonded.
Okay, so our residents that we refer to you are protected because
Yes,
you do
of course.
background checks,
Yes.
everyone's bonded.
The Board of Nursing does a background check on the RNs and the home health aides, but we ourselves do our own extensive background after that.
Very good. What type of employees do you hire in Beyond Caring? I know you have nurses.
We hire social workers, home health aides, LPNs, and RNs.
Okay. So if a patient, after his or her rehabilitation at Delaire, needs some type of home care where they're not able to do their activities of daily livings on their own, is that where you come in?
Yes, our home health aide. First, the RN does an assessment.
Okay.
But that assessment, everybody is unique. So that assessment will give the home health aide the ability to know what needs are met. She'll be able to provide bathing, laundry, medication reminders, because this is all and much more, because the RN is going to put all of that into a plan of care for the RN to follow, for the home health aide to follow.
So if you're in a subacute rehab unit the social worker will refer someone to your home health agency, but how does someone in the community access you?
Through the website.
Which
or
is?
Our website is www.beyondcaringhc.com.
All right. And you have a telephone number where we can reach you?
Yes, our telephone number is 877-717-0085.
Very good. Thank you, Jane, so much for providing us with that information. I appreciate it.
Thank you.
That's
It's a pleasure.
Beyond Caring Home Health Agency. Just to follow up after a subacute rehab stay. Of course, there are VNA services, physical therapy services, and home health services. Beyond Caring is just one of several services that are out there, and I appreciate Jane being on the show today. We're going to take a quick visual tour of Delaire Nursing and Rehabilitation Center, and we'll be back to you in just a minute.
Cabin 129, cabin 129.
I'm here with Nigel Moxie, our Assistant Administrator at Delaire and Director of Guest Relations. This is a typical room at Delaire. Nigel?
Yes, these are the semi-private rooms, and as you can see, the 2 beds, the TVs that are cable ready, and that are free. Also, there's a shared bathroom, because there's an adjacent room also with 2 beds in there. There's closet space for both residents that are in here, and if need be, we also have drawers that they can lock their private things in to keep it secure. And also in these being that they're semi-private, we try to pair up roommates that are more compatible in age or in, likes, or if they're both from Linden and so forth. So we try to, so that they have a better stay here if they have some common ground or things to share.
So this is a multi-purpose room used for breakfast, lunch, dinner, and activities. At Delaire, I understand there are a host of activities, including entertainers that come in from time to time, and the room can be rearranged as needed. So that's a visual tour of Delaire Nursing and Rehabilitation Center. This is the nurses' station at Delaire, and residents can be seen 24 hours a day, 7 days a week at Delaire. There are nurses on, LPNs, registered nurses, and nurses' aides on 24 hours a day, 7 days a week. 2. Social workers at a subacute rehabilitation unit will provide residents and their families with referrals to home health agencies, visiting nurse services, and outpatient rehab centers. As a resident in a nursing home or rehabilitation center, you should meet with your treatment team within a week to discuss your progress and plans after your stay in a subacute rehab center. So keep that in mind when you're in your rehab center, that there's the beginning, then your treatment, and the end of your rehab service. So you will need some type of continued outpatient service. Discuss that with your social worker and your treatment team. That treatment team consists of a physical therapy department representative, nursing rep, a social worker, and a registered dietitian and activities aide or person. Thanks for joining us again on the Senior Report. Keep watching the show as we try to keep you up to date with the latest healthcare issues, treatments, and products that affect you. I'm your host, George Cruz. Thanks again. I'd like to thank Ann Ferguson and the Linden Housing Authority for sponsoring the Senior Report this month. Linden Housing Authority providing housing for the residents of Linden, New Jersey.